We are seeing these numbers, this disproportionate impact across the state.
Black and brown New Jersey residents are more vulnerable to the virus. In fact, they are 2 to 3 times more likely to get sick, hospitalized, or die from COVID-19.
This, of course, goes back to policies of, segregated neighborhoods, segregated schools, segregated access to nutritious food, the long history of structural racism that we have in the state.
Dr. Brittany Holom is the senior policy analyst for New Jersey Policy Perspective. Her report out today finds Black and Latino residents represent over half of essential workers, making them more exposed and more likely to be commuting on mass transit. They're also more likely to hold low-paying jobs, mean less health care coverage and less money to buy nutritious food. Residents of color have also seen higher unemployment rates thanks to this crisis, meaning some may not have access to health care at all. Black and brown residents are also more likely to live in densely populated areas where the virus has more potential to spread.
What we really need is some systematic changes that allow us to prepare better, for when the next pandemic eventually comes.
The report also found that out of all New Jersey counties, only Mercer had a written plan to deal with the pandemic before COVID-19 emerged. It says more diversity is needed in the medical field and more health data collection among minority communities. The report also calls for an increase in funding to the Office of Minority and Multicultural Health, which is in the State Department of Health. For the past 15 years, funding for this office has remained flat. I'm Christy Duffy, Pix 11 News.